Today we're discussing healthcare industry, emerging trends, how to make money in the GCC, and what sectors will lose relevance in the upcoming years. In 2022, healthcare expenditure in the region was about $100 billion. How much will the healthcare market grow by 2030 in the region? And which sectors will see the most growth?
Okay, so first of all, thank you so much for having me. It's an honor and a pleasure to be with you. I think if you read multiple sources, you will look at $215 billion growth in healthcare across Africa, Middle East, or North Africa, Middle East. If you talk about a region like MENA region, there's, again, the growth varies between $250 billion to $300 billion and plus. If you look at the GCC countries specifically, I think the growth is going to be taking most of that figure, 150 billion and above. So a big portion of the Middle East, North Africa growth in healthcare is driven by the GCC countries, strong healthcare economies like Saudi Arabia, UAE, Qatar. We see new players coming into the ecosystem. Kuwait is coming in, Oman is coming in, Iraq, Libya. So Egypt is also putting a lot of efforts in driving more growth in healthcare. I would say it's around that figure, maybe a bit underestimated, maybe a little bit more. But if you look at the sources, mostly you'll see around figures of 250 to $300 billion and moving upwards in 2030.
And from your opinion, who is number one in the region, in MENA region?
So I would say Saudi is on the driving seat, very closely accompanied by the UAE, and followed very closely by Qatar. And then you have the next tier, Egypt, Oman, Kuwait following very soon. But Egypt has the muscles of population mass, where there is a lot of capabilities because of the huge population that they have.
Welcome to the second season of our interviews, and today we're speaking with Dr. Mazin Gadir, a leading digital healthcare expert and advisor with nearly 20 years of experience. Dr. Mazin, if you can present yourself.
Sure. So I'm honored, first of all. Good morning, good afternoon, and good evening to all your audience. It's such an honor and privilege to be with you today. My introduction can be summarized in few numbers: 45 to 46 years in the UAE, 25 years in the healthcare industry. Started my healthcare in a very interesting story. I was an electrical engineer in Leeds University. That was privileged to get a scholarship to do research in quantum electronics and nanotechnology, specifically researching cancer detection and hence marrying quantum sensing with healthcare. That brought me into healthcare and started my career in healthcare in the UK, moved to the Middle East back again almost 15 years ago in Dubai. I worked in a number of different positions. I worked for the government, Abu Dhabi Healthcare Services Corporation, Dubai Health Authority for around 10 years. I worked in the private sector with companies like PwC, Cerner, IQVIA, and recently joined Alvarez and Marsal in the area of healthcare consultancy and digital implementation. I've been always an addict and an advocate for healthcare improvement, and I've been learning in this industry for the last at least 25 years. 15 of them was focused in this region, covering Africa, Middle East, South Asia, with huge focus on GCC countries. A student, a father of 3, and I love swimming, football, and movies.
Nice. Let's start with discussions about the global trends. Which healthcare sector will be the most profitable in 2025, from your opinion?
So I think if you look at the global trends and look at some of the different news updates that we've been getting in the last 2-3 years, you can then set your eyes on some of the major focus areas in healthcare. So number one, the whole world suffers from an aging population issue. That brings us two things. Number one, longevity and people actually building in healthcare the focus around longevity, whether it's bringing the latest and greatest technologies and advancements like genomics and personalized medicine, prolonging your health span versus your lifespan. The other part is the focus on new specialties or neglected specialties like geriatrics, long-term care, end-of-life care, especially in emerging markets. But that's been the biggest headaches across the globe, the aging population. And whatever the aging population impact has, we've seen on the workforce as well. Workforce gaps in healthcare is one of the biggest threats to every nation on this earth when it comes to building your infrastructure for an economy that is deemed to be in national security after COVID-19. So the health economy is one of the most important economies for the sustainability of the nation. And hence why we need to look at the trends surrounding the workforce enablement, retention, recruitment, mental health also that comes with it. If you go now to the other angle, the concepts of mental health and wellness is a huge upcoming focal area that has been affecting corporate productivity, government sustainability, and so on and so forth. You can look at also the concepts of healthcare sustainability and the carbon footprint that healthcare economies has been also contributing to the changes in the weather systems. And we can see some of the latest news coming out of California, very devastating news about the changes of temperatures, dropping of temperatures drastically, increasing of temperatures. The other area is the globalization, the intensive globalization that is happening across the globe. Concepts like medical tourism and the movement of health tourism is becoming a huge focal point globally. And that all of these trends supplemented by the digital infrastructure that is now has become a huge critical concept, because the world is dealing with non-communicable diseases such as cardiovascular diseases, diabetes, wellness, and the concepts of wellness and prevention has come up now to try and tackle some of the NCDs, but also don't forget the CDs, the communicable diseases. The pandemic has shown us the importance of the global collaboration when it comes to predicting and forecasting upcoming communicable diseases and whatnot. So these are a series of different trends. We look at it globally and we can see a lot of attention. The latest that I want to mention, last quarter, we see a huge attention that has been given by the World Health Organization, the ministries of health, to public health and specifically antimicrobial resistance issues, where now they're afraid that some of the drugs and medication that you have to administer to the patients are not effective anymore, which makes you worry about the likelihood of recovery and rehabilitation and treatment. So this is another concept that has become a huge focal point in the last few months.
So you mentioned longevity, wellness, medical tourism. Aren't they connected? And when we're going to see longevity tourism, and what countries will be longevity tourism destination for the next 5 years, from your opinion?
So to answer your question, I think the first, and again, this is my opinion and my study of the economic and environmental conditions. They are connected. When you talk about longevity, you talk about wellness, and then you talk about tourism, the concept of movement of people, humans. If you look at the aging population pain point, which has been impacting not just the global market, but also the local market, I think the focus of many government initiatives in our region here, in the emerging market region, specifically in the GCC countries, is to try and take a leading position, to try and build the infrastructure, attract the talent and the workforce, educate and spread awareness to the population to understand the importance of longevity. Wellness is a critical success factor for longevity to try and equate health span to your lifespan. People can live a long life, but the last 20 years could be their worst time on this earth. So the idea is to try and push the equation. And again, being a quantum physicist, I like to use the equation. When your health span equals or comes close to your lifespan, then that you have created a successful longevity model. How do you do that? You have to start early. Prevention and healthy lifestyle, wellness and taking care of yourself, individual accountability for oneself's health has become critical as we speak. The way we sleep, the way we eat, the way we work, the way we do our life balance. Connect to that the concepts of tourism. The movement of the population around the world has increased. Look at the aviation industry and the hospitality industry and the tourism industry, how they've actually increased our interaction and our mobility around the world. So countries like the GCC bloc or the GCC region has become a very attractive areas for wellness, to attract people for healthy lifestyles, for safety and security, for mental health sustainability, and also for long-term retirement, where you have a very good climate, you have a stable and safe environment, you have a very good infrastructure to do your work or to connect with the rest of the world. So I think, to answer your second question, the GCC countries, Middle Eastern countries, East Africa, Southeast Asia have come to the surface to be growth points and growth economies to attract medical tourism and specifically health and wellness tourism. Even the word medical tourism does not become viable anymore. You're talking about the health and wellness tourism, the concepts of spas and detox, digital detox, work detox, mental health rehabilitation for different population segments using infrastructure that has been put together for a population to move over. The ease of travel, the frequency of travel. So you have a very good infrastructure in aviation now that has been growing, a very good infrastructure for hospitality. And by the way, COVID has tested that. When COVID happened, a lot of the hospitals partnered with hotels to try and provide services and facilities specifically for quarantining using the hospitality model of customer services. So I believe they are connected, and the GCC countries are becoming a leading region in attracting health and wellness tourism.
But my question is also about, we see the trend that Emiratis, Saudis are usually traveling overseas to Germany, to Switzerland, to UK for medical care. Is this trend to be changed in the future, or like we're going to face this in the future, but other nations are going to come to the GCC?
So I think if you separate, these are concepts, once you are diagnosed, then that becomes medical tourism. Before you get diagnosed, that's the wellness and healthy lifestyle tourism, or the wellness and health tourism. So if you look at the medical tourism trends, yes, there are a lot of GCC citizens who travel abroad for post-diagnosis services and treatment. I think that is because of the research infrastructure. The centers of excellence still do exist in Germany and the US, in the UK, where you have the best cardiovascular specialities and services and technologies around the world. I believe that might continue as we are still building our research and R&D infrastructure in the region. I know Saudi and the UAE, specifically Abu Dhabi, is putting a lot of investment to try and localize some of that tourism inwards by building the likes of Cleveland Clinics, Sheikh Shahbout Medical centers that are bringing the latest and greatest in oncology, cardiology, surgery, and treatment. You know, we have proton therapy now available in Abu Dhabi. In Saudi Arabia, you have King Faisal Specialist Hospital, one of the most research centers of excellence in the region, especially in the oncology field. So I believe that the population that are traveling for post-diagnosis medical tourism still will continue, but might be reduced. However, as we are a growing population region, the middle class and those who can afford local medical tourism are getting more and more exposed to the capabilities of the country. So we have countries that are historically known to be medical tourist attractive hubs. Egypt, Jordan, and you can see now there is also the UAE and Saudi that has become very attractive and powerful in the sense that they've built the infrastructure to attract movement of population that are seeking post-diagnosis medical tourism. You have populations that are traveling from Sudan, from Iraq, from Lebanon, from Yemen, that are coming to not just to Egypt and Jordan healthcare systems, but they are now, you can see them spilling over to UAE, Saudi Arabia, where they are actually seeking complex procedures and surgeries, cardiovascular surgeries, heart transplant surgeries, oncology treatment and surgeries, and so on and so forth. So I hope that answered your question.
Absolutely, absolutely. Back to the global level, which sectors will become obsolete in the healthcare system?
Okay, so again, if you're gonna say which sector in the healthcare system will be obsolete, I can tell you maybe it might not in 2025 or in the next 5 years, it might not be a whole sector that will be obsolete, but it could be some certain tasks and for example, some certain processes. So for example, if I tell you with the advent of AI now, which is again a huge trend across the global market and the region that we live in. If you look at how AI is being manifested to eliminate administrative processes, right? That might eliminate some certain verticals within the healthcare sector, but it might not eliminate a complete sector. So administrative processes would be something of an area that will be reduced drastically because of the constant use of technology or AI. I would also think certain health finance processes that might be eliminated. Having so many coders in a hospital to codify your hospital or healthcare documentation, your physician documentation, and turn it into claims, that might be reduced drastically because of the use of AI and specifically in the coding process. So I would say certain aspects within the sectors under the healthcare might be reduced drastically because of the use of technology. Likewise, in pharma and life sciences, the R&D, now you can hear the concepts of virtual clinical trials, where there is a lot of reduction in admin and logistical manual work that would be taken over by AI models, LLM, generative AI models and whatnot. So I would say that certain jobs might have tasks reduced drastically, which require our current workforce to alleviate and actually upgrade their skills and capabilities. So if you look at the concepts of healthcare procurement, supply chain, one of the biggest headaches, the manual processes in that will definitely be reduced drastically, because that will be an area that could be hit with a lot of technology and a lot of digital transformation. The concepts of track and trace, the use of track and trace capabilities, digital capabilities to try and see where your supply chain is going, whether it's pharmaceutical products, medical equipment, medical devices and whatnot. That will eliminate a lot of manual processes drastically. Eventually, we might need to upgrade some of the manual workforce that actually still sit in these areas. So I've mentioned now around 3 to 4 areas. I think the last one that I wanted to share with you medical compliance. I think that's a huge area that is that sits across all the different sectors, whether it's pharma, life sciences, healthcare service providers, healthcare payers, especially in the area of claims adjudication and scrubbing and whatnot. The use of AI and technology would be a huge potential area to try and reduce manual tasks and processes drastically.
What about blockchain?
Oh, so I think with blockchain, we had a very hot few years in 2016, 17, where everything was blockchained. But I think in healthcare, the scale up of blockchain found a lot of challenges at that time, because you translate the technology into clinical lingo for people to adopt in the clinical world was the biggest challenge for blockchain. Now with the advent of AI, I think, and now healthcare after COVID-19 is a huge different ball game. We're talking about an industry that has been promoted from a national perspective to a national security sector. When we come to healthcare after COVID, healthcare, the data concepts and the data management in healthcare has become a huge factor that was neglected previously and now has become a huge important factor for governments as well as for the citizens and the population. Because now you can see the amount of cyber attacks that has happened. The use of blockchain has come back again to the surface with the advent of AI in the post-COVID era, because now we are looking at healthcare as an investment, not as a cost. We're looking at healthcare as a national security prerogative. It's not just another industry. So now we are seeing blockchain coming up specifically in the area of data storage and immutability, the area of identity and protection from cyber attacks. We are seeing that coming up again. Revival of blockchain, I believe, was contributed to by AI and COVID, and much more, other factors as well.
Okay, speaking about the region, how the region differs from the global healthcare trends.
So if you look at the region again, and we specifically focus on GCC, what makes GCC different from the global scene when it comes to healthcare, I think the vast majority of investments that we are getting from the government. So there's a lot of government initiatives that have been being placed in innovation, digital transformation in healthcare. There's a lot of government prerogatives and priorities that has been invested in infrastructure. So for example, let me take you back to the rain incident that happened in the UAE recently, where we had an unexpected amount of rain that created a whole new shift of healthcare matters, where we are seeing now tropical diseases, the likes of diarrhea or dengue fever, appearing in a desert-like climate. That hasn't happened. And look at the marriage between climate change and healthcare agility. So now we are seeing there's a huge amount of infrastructure investment that has been pushed in by the government to try and tackle these anomalies that we don't expect, we don't forecast. Also the concepts of disease burden. In the region, we suffer from non-communicable disease incidents, or non-communicable disease scalable incidents. So you can see that the lifestyle in the GCC countries has contributed to pandemic levels of diabetic patients, cardiovascular patients, and also looking at the lifestyle, we are seeing different NCDs rising to the top, right? Plus, you are seeing a region that has still a lot to build into when it comes to the R&D capabilities of the healthcare. So GCC, when it comes to the Gulf region, when you look at the Gulf region from the perspective of how do they differ, what are the unique perspectives that the Gulf region focuses on. You can start looking at the digital health aspect, the infrastructure aspect. You look at the concepts of burden of disease. The government run programs, preventative and screening programs in the area of women health, child health, and obviously diabetes and pre-diabetes screening and whatnot. There's a lot of focus on that area, and I believe the last maybe point that I want to share with you is the workforce focus. We have in the Gulf region a huge demand for healthcare workforce, different specialities, different capabilities, and most of the population is calculated as expats. So your priority is to try and localize as much or sustain the expat communities of workforce that you have brought in, especially for healthcare, has become one of the biggest priorities of the region as well. So these are some of the areas that I could think of, in addition to access of care, the amount of investment in remote patient care monitoring, virtual hospitals, and you can see Saudi Arabia and UAE is spending a lot of focus and time and effort and money on trying to build more virtual care models and capabilities to cater for equitable access for healthcare. I think the last point that I wanted to mention also, the regulatory framework. Mm-hmm. The regulatory framework in the GCC and the Gulf countries are much more agile in the sense that they are flexible in the changes that they make, specifically when it comes to hardcore concepts. So if you look at localizing supply chain, localizing manufacturing and production capabilities, trying to change the concepts of building a regulatory sandbox, and how you invite the innovation into the country by allowing less regulated healthcare system and allow more startups, more innovations to move into the region, to try and invest in the data that has been collected, produce different angles for clinical research capabilities and whatnot.
What are the main focus areas of government healthcare programs in the Gulf region and MENA region?
Sure. So, and I think that question is related to the previous one. And I'd like to highlight one of the key focal points for the GCC countries: the conversion, transformation of healthcare from a volume-based system into value-based care model. And that is coupled with private-public partnerships, where the government is to try to include the private sector in a growing industry like healthcare, where the expenditure or the healthcare expenditure has been increasing drastically. So I believe these are some of the trends that I think the governments of GCC are trying to focus on: the transformation into value-based care, managing the increasing healthcare expenditures with the inclusion of the private sector through the PPP. And you can see that on the sovereign wealth funds. If we look at Saudi Arabia and UAE, and we monitor the sovereign wealth funds movement in the healthcare market, we can see that the PIF, Public Investment Fund, or the Mubadala, the international holding company in Abu Dhabi, they are pushing more and more investments in focusing on digital infrastructure, workforce infrastructure, education and enablement infrastructure to try to drive more conversion to value-based care, more privatization of the healthcare in partnership with the private sector, more focus on building and promoting concepts like the digital health, wellness, mental health, longevity, to try and invite technologies and innovation in this area. Obviously, all that under the jurisdiction of the transformation we are seeing in the market, where we are moving into a universal health coverage healthcare systems, where insurance mandates have become a huge potential step for the conversion and the transformation of healthcare. We are seeing in Saudi Arabia now a lot of the healthcare payers, insurance companies, are bringing in the new concept of payers, providers, and they merge those two words into pay viders, where insurance companies are also offering primary care services to try and manage the cost. And by the way, the insurance world in the GCC countries is suffering from huge medical inflation, which is surpassing the normal inflation that we have. So that's another headache. So providers, governments are worried about the increasing healthcare expenditure in the GCC countries. Insurance companies in the GCC countries are worried about medical inflation and volume-based healthcare system, and hence they are in support of the value-based transformation. You have the providers that are suffering from workforce gaps, lack of digital, for example, transformation and digital adoption, the lack of being able to maintain your profit margins based on non-operation based services, because 60% of the revenue in a hospital comes from the operations, the procedures, the operating rooms. So how do they diversify into other revenue making avenues? So again, the citizen is modeled up. We have people who are now getting, and residents who are getting insurance coverage, but it might not be enough. How do you cater for for example, the blue collars or the white collars, and try to understand the needs for the low income segment? And how do you cover healthcare? How do you actually build the infrastructure for research and development to invite pharmaceuticals to fund some of the complex cases we have in oncology or cardiovascular or endocrinology and whatnot? So if you look at the focus, strengthening primary care is very key. If you look at the digital health mandate across the UAE, Saudi Arabia, there's a huge focus on that. The transformation and the regulatory mindset, and how you can invite and not scare investments to come in. The focus on PPP to help manage the medical inflation, the rising expenditure in healthcare, the low profit margins that are being challenged continuously, the patient-centric models that you want to bring in, so the rights of the citizens and the residents for a good healthcare service and healthcare equitable access as well. So there is a lot of focus on that, and on top of that, you cannot forget the focus on public health. There's a lot of public health agenda that has been issued out, and you can see that very visibly from Abu Dhabi, Dubai, Saudi Arabia, and so on and so forth, in order to prepare yourself for any communicable disease pandemics, future pandemics. Try to manage your non-communicable disease, public health awareness, and so on and so forth. I've thrown a lot, but I hope that gives you.
So what I understood is basically, so we're going to face lots of small optimizations on a different level.
That's right.
So can you give an advice to the startups, to the private sector, where to look to find this opportunity to penetrate the market, to bring your idea to life and so on, through these kind of optimizations?
Absolutely. So I think my advice for the startups and the new entrants is to research your partnerships. You need to understand the market you're entering in. Whether it's Saudi, UAE, or Qatar, you need to, first of all, remember these health systems are under huge pressure, and these pressures are because of the workforce, the complete transformation that is happening from a hospital-based health system into primary care-based system, the universal health coverage mandate that is changing the way we pay for healthcare. We are looking at a healthcare system that is trying to move into value-based care, but is still trying to make all the success factors contribute. A population that is growing, but still aging. A workforce that is being demolished because of the mental health pressure or the lack of talent in the market. So as you round up all these areas of focal points and pain points for the health system that you're trying to work with, you have to devise a plan of strategy to partner with the right combination of alliances. So you probably might want to work with a hospital and perhaps approach some insurance companies and look at also the existing technology companies that you want to work with in order to give you a smooth entry into the into the markets. The problem that you're trying to solve has to be relevant to the stakeholders that you are working with. Number one. Number two, you need to also look at the government programs that are enabled for startups. So for example, if you work with Plug and Play, ADGM, Hub 71, In5 Tech, or some of the programs that a government has devised for attracting the startups and the minds, the great minds of the world to try and come and solve problems, is normally a big avenue for you to get a smooth ride into the market. The other element that I would like you to pay attention to, access to data, especially if you are a startup in the technology, right? Data is a huge, I say, challenge in the region to try and get the data, but I would say it's a challenge that needs also a lot of perseverance, a lot of partnerships, and you have to be patient as you will get the data, but sometimes from multiple different sources for the data to be validated. And again, there's a lot of investment by the government to try and open up more quality data, revamp the data hubs that we have in order for researchers and startups to come and do some work with. So alliances. Do your homework by studying the market. Make sure that you are also funded, at least from the funding mechanism in the region is maturing up. There are some good sources of funds that you can place your hand on. I would say that investment and entrepreneurship mindset is growing hugely. I would definitely invite the startups to don't put all your eggs in one basket. Make sure that you have multiple ways of finding funds, including your access to the global funding resources, whether it's the National Institute for Health in USA, or the EIC, the European Innovation Center, or other funding mechanisms that are globally known that you can utilize while you are also entering the market here. So always make sure that you have your contingency plans and your multiple avenues explored as you come into the market.
Let's paraphrase it a little bit. So your advice to startups is to come to the region and not look investments immediately, but to start making partnerships.
Correct.
To validate your idea,
Correct.
To show that your idea is valid, is needed in the market, right?
True.
And only after this, only after signing partnerships, there is a next step will be investments.
Absolutely,
right?
Absolutely, and that's very critical, because when you manage your expectation, if you manage your expectation well, you are able to penetrate the market, not just with your mindset on investment as the first priority. Your first priority is to find the right ecosystem that you can plug yourself in, and this plugging should be validated with the problem you're trying to solve. The people who would help you, who would benefit from this solution, need to be around you to give you that credibility and give you a bit of energy and power to start building your roots into the market, and then start thinking about investment and funding as a second stage. That's why I beg of the startups to make sure that they have enough runway and patient mindset and perseverance. That's why coming into the market, it might take some time.
Yeah. Like, from your opinion, how open local companies for these partnerships? Like, how easy to get reach to M42, to Evolution, big guys, and small guys, of course.
To be honest, I believe the accessibility to the big shooters is I think it's there. I believe it's not difficult, it's not challenging, because of the number of events that we have. So for example, participating in conferences. We know Arab Health is going to be happening in 2025, and that's a huge access to the right amount of leaders, partners, and collaborators in the region. Access to sovereign wealth fund companies that are interested in formulating this, or trying to find problems that can be solved in order for the investment to make sense. And all the hubs that come around Because if you become part of the Hub 71, you'll be able to meet the most influential and insightful ecosystem stakeholders in the Abu Dhabi health economy. So you'll be able to meet DOH, Department of Health, Mubadala, you'll be able to meet players from the different investment sovereign wealth funds. You'll be able to meet hospital groups, the likes of Sheikh Shakhbout Medical City or Cleveland Clinic. So I believe that from an access perspective, it's not challenging. It's there. You have hubs that you can utilize to facilitate your soft landing and soft access to these stakeholders. You have events and conferences that would allow you to engage and meet and start engaging and interacting. The most important part in this region is the cultural engagement. People like face-to-face meetings. You might not sign the deal from the first meeting, but you might have that face-to-face synergies that will enable you and facilitate signing some sort of a partnership in the 100th meeting. So it's very important to be on the ground. It's very important to be in their face.
So communication and patience, right?
Absolutely.
And what about Saudi, by the way? So
Saudi is intensely a wonderful area to dig yourself into. I would think that Saudi, because of the size of the population, the size of the health market, is the biggest healthcare economy in the GCC countries. And I would love to tell you that Saudi is another amazing ecosystem, specifically as you build personal relationships. And it's driven by personal relationships. Trust is the name of the game in Saudi. You build trust, you engage, you show your credibility through your relationship building skills, through your scientific evidence-based approach, and face-to-face meetings, and that will drive your relationship in Saudi Arabia. Once you build that trust ecosystem, facilitated with your evidence-based capabilities and proof of concepts and minimum viable product and solution that has been tested out, which might require you to invest time, money, capability, people, to allow people to see the evidence. And this will facilitate or will help you formulate the partnerships that would get you into being incubated in Saudi Arabia. So again, an amazing market, advising the healthcare startups from the globe to actually visit and investigate and invest in. There is the Global Health Exhibition, which happens every October of the year, the biggest healthcare gathering. And there is also LEAP coming up in February, the biggest technology gathering. I'm talking about 100 to 300,000 people in both of those events. So again, you will find partners. The local market is hungry. The Saudi workforce is completely top-notch and hungry to grow. And you have amazing research centers like KAUST, King Abdullah University of Science and Technology, KAXT, King Abdul Aziz Center for Science and Technology. These are amazing hubs. King Faisal Specialist Hospital and Research Center. They're amazing hubs that are looking for incubating and partnering and nurturing amazing startups with great problems to solve.
What other countries are good for finding partnerships, for making partnerships and finding investments?
So the triangle of innovation in this region rotates around Saudi, UAE, and Qatar. If you look in the second level of upcoming and emerging economies of health that I would like you to focus on, definitely gonna involve Kuwait, Bahrain, and Oman at the second level. Egypt is with that level or in the same level, because again, we're talking about upcoming economies. But with Egypt, because of the huge population, I definitely focus, I would like to advise the startups to focus on huge partnerships in Egypt or global programs, global funders like WHO, World Bank. Partnering with those might enable you to get into solve complex problem in a very highly populated countries. And then I would then take you to tier number 3, where it will bring in countries that has huge potential: Iraq, Ethiopia, Turkey, obviously India on one side, but again, partnerships with India where you can set up your base in the GCC countries and then scale up in these tier 3 countries, the likes of Iraq, Ethiopia, India. I will add Morocco as well to it, because Morocco is another growing economy, hugely stable, huge potential, and Libya. Those tier 3 countries, I would definitely keep them close to you, as you said, your hub. But these economies are hungry to build infrastructure, bringing startups that could scale up. And you have heavily populated countries, the likes of Egypt, Ethiopia, Turkey, and India. These are where your scale up, your pricing strategy should be different. Your scale up ambition should be also aggressive in them. And your partnership and alliances perspective should be also explored.
What is the best country to start your business to conquer the Gulf region, and the same to conquer, for example, Africa?
So I think for both, you can say UAE and Saudi would top the charts because of the business acumen, the business ease of setting up a company. UAE comes definitely first. Dubai, Abu Dhabi would be definitely a great starting point. I would then say Saudi comes very close, as Saudi is changing. But Saudi will attract you to solve local problems more because of the heavy investment in population and heavy investment in the market. But to conquer Africa, I see a lot of companies that set up shops or startups that set up shop in UAE, and they use UAE as the bridge into Africa to try and invest into scalability, into growth. Rwanda has become another nation that is growing through the ranks when it comes to stability, attractiveness for startups, bringing funds for startups, specifically from global funders, the likes of WHO, World Bank, USAID, Melinda Gates, Clinton Foundation. So I believe Rwanda is another attractive stepping stone into Africa, as well as Egypt. If you start with UAE into those countries and into that continent, that could be a possible option.
Let's get back to the Gulf. Let's talk about medical tourism. What are those trends in medical tourism here in the region? What would be the future of medical tourism? What would be the main destination of medical tourism here in the region? What country or what emirate would be?
So I think when it comes, and I'd like to make the audience pay attention to the wording, because there's medical tourism and there is the health and wellness tourism. When we started doing the strategy for medical tourism in Dubai Health Authority, the first initiative was to change the word from medical to health and wellness.
Okay.
Right? Dubai, for example, at that strategy in 2017-18, we were looking at what are the most attractive specialities to bring people into the UAE, right? From, for example, dermatology to dentistry, to orthopedics, to ophthalmology. These might be the services that would be attractive for people to come in. I'd say it's gonna be based on the speciality. That's where you would look at where you would like to come in. Abu Dhabi has placed itself to be a medical tourism hub for heart transplant, cardiovascular, as they're building their capabilities with the likes of Cleveland Clinic, Sheikh Shakhbout Medical City, Tawam Hospital, where they are now building their brand and knowledge and capability in oncology, cardiovascular, transplant area. Dubai is also putting a kind of an organ transplant strategy to be an attractive area for organ transplant procedures. So it depends. You're probably gonna be looking at multitude of technology. Why I say Dubai and Abu Dhabi? Because of the ease of travel. So when you look at medical tourism, you look at number one, travel, you look at the cost, you look at the experience. Travel meaning access. So access, cost, and experience. If you look at those three parameters, Abu Dhabi and Dubai are well connected with a huge infrastructure in aviation and hospitality. That's number one. Cost, again, we're not talking about the lowest of cost, but we're going to look at middle to high cost capabilities because of the brand name we have, whether it's Mayo Clinic attached services and facilities or Cleveland Clinic and whatnot. If you look at experience, you cannot hide the fact that we are in the best branded cities, whether it's Dubai or Abu Dhabi, because of the great experience that you have from a safety perspective, from the the mobility perspective, and also from the level of relationship and services perspective. So definitely Dubai and Abu Dhabi will be top. I don't want to create any friction, but I'll say those are two amazing hubs for medical tourism. Based on the speciality, we look at it. For example, dental services. Dubai has become also an attractive hub for dental procedures and dental dental services. Cosmetics, derma processes or derma procedures. I think dermatology is a huge attractive specialty in here for incoming travelers. The health and wellness, and as I said, mental health rehabilitation, detox programs and whatnot, because of the many spas and the different hospitality programs that we have and capabilities that we have. The infrastructure was built. Dubai is a great hub. I would also not stop reminding the audience about Saudi Arabia. We have huge infrastructure that has been built. King Faisal Specialist Hospital is the most researched healthcare system in Saudi Arabia. Second most research system in Saudi Arabia is the National Guard Health System, where you look at their capabilities in NCD capabilities, cardiovascular, oncology. They have huge, deep capabilities and workforce talent that has been built. Again, that could be also another attractive proposition. These systems in Saudi are coupled with huge academic infrastructure. And that could be another side of Saudi that surpasses the UAE, is the academic and research capabilities that has been manifesting in the last 50 years and has built a brand of its own.
What are the region's major healthcare projects?
So I think if you look at, let's say, the UAE, and at the moment we have been seeing a lot of digital health programs that have come to a large maturity or a high level of maturity. So if you look at Abu Dhabi, you look at the Malafi program, which is the health information exchange for Abu Dhabi, allowing the interoperability and data transferability between the different healthcare providers, that has created a huge amount of economy around data. So I believe that's one big, massive program that is now become a huge attractive point for startups and companies to come and build services on top. Likewise, in Dubai, you have the NABIT program, which is reaching or maturing up in progress, connecting the private sector and public sector when it comes to building a digital infrastructure that allows more research, more innovation as well, and attracting startups and researchers alike. Saudi Arabia has built a track record in massive programs. Obviously, Nafis was a digital infrastructure that has been put together to connect not just the clinical but the financial data as well, and create a huge virtual transactional highway for these two types of data hubs. And this is going to become a huge fertilized ground for innovation and research. I believe the mega projects or the giga projects that the Saudi has been working on, the likes of NEOM or the Red Sea, building infrastructure for the smart city programs around the Saudi ecosystem, is another very attractive perspective. I would also invite you to look at some of the strategies that have been announced in the biotechnology strategy of Saudi Arabia, or the Dubai industrial strategy in Dubai, where we are inviting and bringing more capabilities in localizing production and supply chain. Don't forget, pharmaceutical and medical device industries are still relying on the importing or the import need, or the needs that are imported within the UAE and Saudi, and that they want to reverse that equation, where they want to build major manufacturing and production facilities that comes with digital infrastructure, workforce enablement infrastructure, regulatory framework, and whatnot. So again, the localization of supply chain and production is another area that I would invite people to look at. Between the giga projects of Saudi Arabia and the many strategies that Saudi and UAE have, I think there's a lot of great forecast for infrastructure, for capabilities and whatnot. This will be topped up with the amazing strategies that are being released by the sovereign wealth funds. Between Saudi, UAE, and Qatar, we have no less than, I think, total $4 trillion of sovereign wealth funds that are trying to invest in the future of the economies. And one of the most important economies are the heavy economies: pharmaceutical, life sciences, production, manufacturing of medical devices, medical equipment, and also the digital infrastructure and the smart city economy, where you look at sustainability, climate change, and whatnot when it comes to healthcare. So these are moving parts that you need to keep an eye on. Monitoring the government strategies, the sovereign wealth funds, looking at the big private sector groups, the likes of the family offices and the family-owned businesses that are venturing into healthcare systems, healthcare economy. So these are some moving parts that would allow you to be excited as well about the future.
You did not mention two big projects, genome projects in UAE and genome project in Saudi.
Yeah.
How these two projects will transform ecosystem, the future of healthcare, the investment kind of ecosystem and the strategies.
Absolutely, and I think the genome programs that are being undertaken in the UAE and Saudi Arabia would have definitely a significant amount of impact. From a digital perspective, the digital infrastructure that has been built and would be expanded upon would enable us to harvest a huge amount of data and grow personalized medicine and longevity industries and create more depth. I believe definitely there's a huge amount of attractiveness around those two programs, and how these two programs can be commercialized on the next stage. Saudi Arabia has built governing bodies like Saudi Data and Artificial Intelligence Authority, SADAYA. They built the Saudi National Institute for Health to try and bring the might of mega projects or giga projects like the genome program to try and build commercialized outcome and tangible output from which then it can be fed into expanding the healthcare industry. So I completely agree. I know, for example, in Abu Dhabi, the genome program has brought in collaborations like Mohammed bin Zayed AI University and Mubadala capabilities and infrastructure capabilities. And that is yet to manifest into more expansion in building output and building economies of scale, and link it up to obviously research hubs like Khalifa University or New York University, or the research hubs that has been built in Saha, Abu Dhabi Healthcare Services Corporation, or Department of Health. We have leading figures like Professor Sharouk Al-Hashmi, who's now bringing that ecosystem together to try and plug in genome programs into gene editing capabilities, and bringing the pharma industry and the CROs, the clinical research organization, to try and partner with the government sector and look at certain investment potential in linking this up with genomic capabilities into actually building personalized medicine treatment plans.
Precision, absolutely.
Absolutely. So,
how can you evaluate pharmaceutical market in the UAE and in Saudi?
So I think let me start with Saudi. I think the Saudi Arabia has put a lot of attention in building localized supply chain and production manufacturing capabilities, specifically in the pharmaceutical industry, and there's a lot to be done. I believe the infrastructure of Saudi would allow it, and the population mix in Saudi, to allow it to bring in, number one, a much more depth to the Saudi FDA as a regulator, to allow more clinical trials and more research. The research infrastructure in Saudi is maturing up so quick and has been invested in for the last 50 years so well. And I think that brings Saudi on a higher level when it comes to the R&D capabilities, which is very, very critical for any pharma life sciences investment to be materialized. You cannot say I can bring pharma life sciences companies without investing in R&D, investing in intellectual property and safeguarding of the new innovations that you can come, and obviously have a population that can be tested and used for clinical trials. And I think that's what the Saudis have been excelling in, is they are building the infrastructure. They're continuing to expand that infrastructure, the research and education capabilities to produce talent, to build research and publication depth is being expanded upon. If I come to the UAE, I believe there is a lot of plans to expand on this area. One of the biggest sectors that has been focused on by the sovereign wealth funds and the healthcare stakeholders is to bring in more pharmaceutical life sciences capabilities into the region. Despite the fact that the population is limited, but what you can do, you can actually build new concepts like cross-border virtual clinical trials, the use of interoperability, go into government-to-government programs to try and take some of the capabilities that you have built in the pharmaceutical life sciences into heavily populated countries, the like of Egypt, India, Turkey, and whatnot. So I think Abu Dhabi is doing a lot in this sense, is trying to put a roadmap for building more infrastructure, investing in more capabilities in the pharmaceutical life sciences, plus try to attract the pharmaceutical life sciences ecosystem from the West to set shop here, bringing their R&D capability, their incubation and innovation capabilities into the region, and also help produce a workforce enablement program to try and bring talent. Don't forget, we still cannot match the Golden Triangle in the UK, Cambridge, London, and Oxford, that produces a lot of pharma, life sciences, innovation every year, contributing billions of pounds to the economy. But we're trying to emulate that and build that in the UAE. I guess UAE and Saudi, huge potential, huge focus as the population is growing. And also we are thinking out of the box when how to actually produce more use cases where pharma life sciences can use digital infrastructure, virtual clinical trials, interoperable cross-border health information exchange to try and run your clinical trials and produce more customizable pharmaceutical products for the ethnicities that we are seeing in this region. And I think that's one of the biggest areas. Most of the products, the drugs have been tested upon white Caucasian, mostly in the West. So now diversifying that in a growing emerging economies like the Middle East, UAE, Saudi, would be the huge focus in the next 5 years.
What is your advice to private sector, how to survive in a pharma sector in the Gulf?
I think. Look, I believe the survival manual should include collaborating with the regulator, being close to the regulator and being close to the strategies and do's and don'ts with the regulator would allow you to see how the progress is happening, especially in the pharmaceutical life sciences industry. And again, I can tell you, partnership and strategic alliances with like Dubai Science Park, DSP, led by an amazing scholar in the region, Mr. Marwan Al-Junahi. I think there is a lot of great content and great support and advice from entities like that. If you look at Saudi, I would mirror the same. KAUST and KAXT are huge endeavors, being close to not just the regulators, but the research institutions. Al Faisal University is one of the big medical schools there. They have great insights and great research capabilities. The National Guard health system has great research capabilities. KAIMAR, King Abdullah International Medical Research Center. KAIMAR is one of the biggest, most research institutes in the region. So having the collaboration with these entities might allow you to be part of a maturing sector. Pharma life sciences. You're still going to have to face the challenges, the lack of workforce, the lack of research infrastructure, the lack of publications and whatnot. But you are seeing a lot of focus from the government into enabling the regulators, the research institutes to indulge in this sector. So being close to those. Number 3 is making sure that you formulate some sort of a portal where you bring in the latest and greatest from your country of origin, whether it's the US, the UK, or the Southeast Asia, to try to make sure that you bridge the gap by the knowledge transfer, because still pharmaceutical life sciences have a lot more to offer in the West than in the Middle East. But trying to attract some of that into here, that could be part of your mandate in your survival manual, to try and bridge the gap between the latest and greatest in the pharma life sciences industry from the West, and bring that into, in collaboration with the government, the regulators, the research institute, to try and build. And also partner with stakeholders. The distributors are trying to diversify their methodology. The big players, whether it's like a modern pharmaceutical company in Dubai, Pure Health in Abu Dhabi, which is an arm of the national holding company that could actually bring you also a lot of visibility. In Saudi, you can be part of the NEPCO ecosystem, the National Unified Purchasing Company, which is the arm of PIF, Public Investment Fund. Work with distributors, the likes of Tamar Group and other big players in the pharma companies in the localities that you serve. But again, try to understand the mindset and and work with them in order to try and solve some of the challenging problems, could actually bring you more attention, bring you more investment, more credibility and whatnot.
3 advices for investors, where to invest money in 2025 here in the region. So
I believe number 1 will always be digital health. I think that's the fastest growing sector within healthcare. Digital health could cross multiple stakeholders, providers, payers, and pharma life sciences. Again, digital health, digital solution will always be a growing field. The concept of virtual hospital in Saudi has become a success story, and based on that, I think you can build a number of mega programs will come in, including genome program that would require more digitalization and whatnot. So digital health is a great number 1 priority for you to invest in. Number 2, I would definitely believe the area of coding, fraud, waste, and abuse, the area of insurance headaches, right? There's going to be a lot of compliance and fraud, waste, and abuse potential there for you to invest also, whether it's a technology or a process or a service that you can offer in this area. So the health finance and health insurance area. So after digital health, I would move into that health finance, health insurance, because it covers coding, fraud, waste, and abuse. Because as we digitize, we're probably going to be shifting more into value-based care. More value-based care meaning more different payment models, more insurance capabilities and claims processing and whatnot. So that's the second area. The area of health finance, health insurance that is attached to value-based care. The third area is education and enablement. The fact that workforce is the biggest headache. When we saw the Minister of Health come and give us an amazing opening keynote during Global Health Exhibition in Riyadh, his workforce enablement and protection from mental health issue was number 2 big pain he's been speaking about, or 3. So I think that's another hot area that I would like investors to invest in. So digital health, health finance, health insurance, value-based care, workforce enablement. I'll give you a fourth one just for the sake as a gift: supply chain. Localizing of supply chain production. It's a huge area that you can invest in, because I'm remembering the speech from that keynote that His Excellency has delivered. Localizing supply chain is number one pain point for the healthcare system that we have.
Priority and pay point.
Absolutely.
The last question: will the region see a cure for cancer in the nearest future?
I believe yes. The region is working towards finding a cure for different types of cancers, and I believe the research that is being built globally needs to be expanded upon. And I think the region is building the infrastructure to bring in the minds, the creative minds, and the capabilities and the technologies to research, to explore solutions for cancer. And now, you know, cancer is multiple types, so you're probably going to be looking at the types of cancer that are prevalent in the region that will be obviously subject for research. The short answer is yes, but how long do you think before they find certain cure? As we start using AI, I believe that period is shortened, and the way the direction of the region, how they are depending on AI to scale up economies, and the use of AI in finding solutions, going through research mechanisms and approaches, might enable us to be faster in finding certain cures, certain treatments for certain types of cancers in this region. And I think that is being driven by the hunger for AI, the hunger for building infrastructure and research, bringing the greatest minds into the region to try and evolve research.
Thank you so much. Thank you so much for your time today. Your contacts will be in the comments to this video. Thank you. Have a great day.
Thank you. Thanks a lot. Much appreciated.